This is a half kneeling hip flexor stretch with a round ligament massage or release that can be helpful during pregnancy. So basically, you are going to feel a stretch through the front side of this back leg. So if you have this back knee that's down, what I like to do is have you tighten this back glute. That's going to kind of help you kind of tuck your pelvis just a little bit. You can also pull back through this front heel, so your foot doesn't leave the ground, but you're pulling back through the front heel. That's going to help you engage the hamstrings, which also helps control your pelvis, so that way we're in more of this tucked position. So we don't want to be here, okay? I don't want you leaning forward like that. That's not going to do anything but stretch the front of your hip capsule, and that's what we don't really want that. We're trying to get the muscle here. So again, pull back through the front heel, tighten this back glute, kind of feel then a good stretch here through the front of the hip and the hip flexors. If you need even more of a stretch, you can raise this arm and you can gently side bend towards the opposite side and just breathe here. Practice that good diaphragmatic breathing pattern. Inhale through your nose. Exhale. Just relax. Or you can twist. Sometimes a twist helps a little bit. And again, we're breathing here to help that nervous system kind of calm and release everything. And then to add to that, you can take your fingers. Your round ligament sits kind of low in the abdomen near the groin area, and it supports the uterus. So you can just kind of gently massage. So your deep abdominals help support the round ligament. So by working on strengthening the deep abs and the deep core system during pregnancy, that can help with round ligament pain. But this can be just kind of a gentle way, and it's real gentle. You're not pressing a ton here. Just don't want to irritate anything, but you're just holding this hip flexor stretch, and then you're kind of massaging right where that round ligament sits, where you get that pain during transitional movements. So you can try this on both sides, and you should just feel a release through the front hip flexors into the quads during that exercise, and add a side bend or a rotation as needed to feel maybe a little bit more. And then hopefully you find a little bit of relief from that. You can always test, retest, meaning do a movement that typically causes you that round ligament pain, do that little stretch round ligament release, and then for maybe 3 sets of 30 seconds on each side, and then do the activity or movement that was painful, and hopefully it should feel a little bit less painful afterwards. And that is a good sign that it might be something that is beneficial